Good evening and welcome to this live telephone town hall. We are dialing out to tens of thousands of homes in South Carolina tonight. And on this telephone town hall, we're going to be answering your questions live, including questions about the coronavirus. Congressman Ralph Norman will be joining us in just a moment, and he has several expert guests with him tonight, several medical doctors who can give you more information on coronavirus. I want to tell you how you can participate in tonight's call. You can press 0 at any time if you have a question. You can press 0 and you will be placed in a queue, and our operators will then assist you in asking your question to Congressman Norman. He's going to answer as many questions as he has time tonight, time permitting, and we're going to get through as much as we can. If you do have a question but you don't want to go live, you can let your operator know. We'll be happy to read the question for you, whatever's most comfortable for you. We also want to encourage you to press 7, and you will get the very latest from Congressman Norman's office through email. You can provide your email to his office by pressing 7. We appreciate everybody joining us tonight, and I'll repeat this information for those who have just joined us. We welcome you to this live telephone town hall forum. Tonight we're dialing out to thousands of homes in the South Carolina 5th District, and on this call tonight, we will be hearing from Congressman Ralph Norman, and he will be answering your questions along with questions about the coronavirus. Congressman Norman will be joining us in just a moment, so please be patient with us. He has several expert medical guests here who can give you more information on the coronavirus. Before we get started, I want to tell you that you can participate in tonight's call by asking live questions. Simply do that by pressing 0 on your keypad. When you press 0, you'll be placed into a queue, and our operators will then assist you in asking your question to Congressman Norman. We're going to get to as many questions as we possibly can tonight, time permitting. I also want to encourage you to please press 7. Press 7 to get email updates from Congressman Norman's office. He's going to provide you more information on the coronavirus as it happens, so please press 7, as well as other congressional updates that come along. With that, Congressman Norman, we've got a good audience for you tonight, so let's please get started with your remarks.
Great. Thank you, Ivan. Good evening. This is Ralph Norman. I'm a congressman for the 5th District of South Carolina. If you're receiving this call, it's because you're a constituent of the 5th District, in which I have the honor of serving you in the United States House of Representatives. You know, these telephone town halls are normally an opportunity for me to reach out and hear directly from you about the political issues that you care about. But today, this is totally different because this one issue is overshadowing everything, and it's the COVID-19, also known as the coronavirus. Tonight, you'll hear directly from myself and leading experts about the virus itself, how it can affect you, and what our government is doing to mitigate these effects. I want to thank you for taking time to listen in and to remind you that this situation is developing very fast, which is why I would recommend signing up for regular updates through my website at www.norman.house.gov. And believe me, it's changing by the minute. Folks, I know many of you are worried about this virus, and rightfully so. There's a lot of information out there. Some of it is accurate, some of it is sensational, and some of it is just harmful. My aim tonight is to give you clarity and to tell you how I'm working on it to help all of us. With me are experts who can speak in great detail about many of the questions that you're likely to have. First, Dr. Arash Poursina. He is a board-certified physician and an expert on infectious diseases. He joins us to provide a medical perspective on the coronavirus. Secondly, we have Dr. Michael Kacka. He leads a team of medical consultants at South Carolina's DHEC and will be sharing his expertise about current statistics, containment efforts, and what people should know about the perspective of state government. And we also have from our office Kathy Rose Hicklin, who is an expert on constituent services and helping people navigate all the various agencies of our federal government. Before we get to them, I just want to start by sharing with you some of the good news about what Congress and the administration is doing. As of now, Congress has responded in basically 3 phases. Phase 1 consists of a governmental supplement which is $8.3 billion, which is sent directly to the agencies on the front lines dealing with this illness, such as the Centers for Disease Control and Prevention. You may hear the acronym CDC. And this legislation has been passed by Congress and signed by the President last week and is in effect and ready to go. I voted in favor of it because it was the first step of our efforts to try to corral this coronavirus. Phase 2 was supposed to be a relief package for Americans affected by this disease. I had several issues with the bill. We never got to read it. It was at the dead of night, and as I've heard afterward, it was devastating to a lot of small businesses and millions of Americans who work for them. I've received numerous calls from different businesses that had questions or were just against it. But it is what it is, and it passed, and we can talk about the details of it as we go on later. One good news, it was altered after a lot of us raised Cain about it, and a lot of the things that were changed were good things, particularly for small business. It was signed into law by President Trump this Wednesday. Phase 3 is an emergency stimulus package for families, workers, and businesses. This bill is only in the Senate now. It'll come back to the House, but only after the Senate passes it, which, as we speak, they have not done. The content of the bill is still it's up in the air. It could change by tomorrow, and the price tag is probably going to be over $1 trillion, which is a quarter of our annual federal budget. Just some specifics. There'll be some combination of individual relief. There'll be an expansion of health care funding, and some businesses will get some relief. President Trump and his administration has been working overtime to contain the virus, including travel restrictions from China, Europe, and now Canada, which has spread the slow of the virus. And the State Department is working hard to bring back Americans that are stuck in these regions. By declaring a national emergency, the President has freed up a little over $40 billion in FEMA disaster relief funds to address the crisis. And this afternoon, the President has enacted the Defense Production Act, which is in order because it's going to mobilize the full might of our nation's manufacturing base to produce equipment that we need to fight it. There's a lot more to come as we work through this. Vaccines are being developed. Protective equipment is being made as we speak, and really at every level of government. As we mobilize, I need to be honest with you and tell you the government cannot meet this challenge by itself. This is a test of our resources. It's a test of our community. And whether we rise to this occasion will depend on our people, and really not politicians. It's time for us to remain calm and care for each other. I don't think it's a time to panic, but it's a time to remain vigilant and to follow the guidelines that are in place to keep our community safe. We all need to take precautions to avoid the spreading of the virus. When you go shopping, take what you need, but not what you can just carry out. When you meet in public, limit the space. Wash your hands, and it's the basics, because this disease is 3 times more likely to spread than the flu. But there are a lot of other measures that we'll be facing, and as a nation, we'll get through this. We're all Americans. Okay, let me turn it over now to Dr. Poursina for opening remarks, and then we'll hear from Dr. Kacka. Dr. Poursina?
Yes, Congressman. Thank you very much for this opportunity to reach such a large audience and hopefully answer some of the questions. I wanted to start. There's been a lot of questions that I've been receiving. Most people do not really know what coronavirus is. Coronaviruses have been around for a very, very long time. Usually they just cause a simple cold, and most people recover from them quite easily. What is special about this COVID-19 or the coronavirus disease 2019 is that this is a new form of the coronavirus. It's caused a global pandemic, and what is special about it is that it can put at risk the elderly and those who have underlying medical conditions, cardiac or pulmonary, renal, or the sickly, and those are the ones who don't usually do well. It has caused a lot of deaths and a lot of mortality worldwide, and it is now spreading quite fast. It's very highly contagious, and it tends to survive on surfaces for an extended period of time, depending on the type of surface it is, which leads even to increasing its contagiousness. And as a general rule, as you mentioned, hand hygiene is one of the core principles to prevent transmission. Social distancing, because this virus is aerosolized and can transmit easily in that way. And if a person is sick or have cold-like symptoms, they're very highly encouraged to stay at home and avoid public places. In fact, if they are not very sick, I would highly recommend that they avoid coming to the hospitals, because the hospitals also are full of sick people, elderly people who are at very, very high risk of having bad outcomes with this virus. With this, I would take any questions later on that the audience may have, and I'll pass on the opportunity to Dr. Kacka.
Dr. Kacka.
Yes. Thank you, Representative, and good evening. I appreciate the opportunity to speak at this tonight. As you know, DHEC continues to investigate an increasing number of cases of the novel coronavirus, COVID-19, in multiple counties across our state. As of today, we reported receiving 125 confirmed cases from our public health laboratory and also private laboratories. 25 counties now are reporting at least one case. Our top priorities remain reducing the spread of the disease and protecting the public health. This includes working to control spread and sharing measures that best protect our neighbors, friends, and family. Be assured that we are working hard to take steps aimed at keeping all of our residents safe. According to the CDC, this is a historic, unprecedented outbreak, the likes of which have not been seen since the influenza pandemic of 1918. This will likely be an extended response, and we want people to be prepared for more cases to occur and to continue to listen to and follow recommendations from public health officials. Realizing that spread is occurring, when you hear about the first cases or growing cases in your community, we encourage the public to focus on things that each of us can do to limit the spread of illness. This includes washing your hands and covering your mouth when you cough. Individuals with signs of illness must stay home and not attend public gatherings. We tend to spend the most amount of time interacting with those we live closest with. That understandably raises concern about what level of caution we should take to do necessary activities. So everyone should monitor for symptoms and practice social distancing. Avoid touching frequently touched items such as doorknobs and rails, and regularly wash hands, and always after being in a public place. We continue to learn more about COVID-19 as this outbreak progresses. The people who are greatest risk are those who are older and have serious chronic medical conditions like heart disease, diabetes, and lung disease. As cases increase, we will prioritize identifying close contacts who are at high risk of illness from exposure and who are most likely to have these serious illnesses. This includes our nursing homes and assisted living facilities, as well as other vulnerable populations with unique circumstances. You may be charged with helping to take care of a family member, friend, or neighbor who is at greater risk for becoming ill. Follow information provided by the CDC and DHEC to safely provide this care at home. Lastly, always be thoughtful about how others are feeling during this time and reach out to them regularly to let them know that you and our state are here for them. This is an emerging, rapidly evolving situation, and DHEC will provide updated information as it becomes available. We will continue to provide updates on our webpage, scdhec.gov/COVID-19, COVID-19. And I will pass it back to the representative.
Thank you so much, Dr. Kacka and Dr. Poursina. Now let's open it up for questions, and be glad to take them now.
Thank you very much. Folks, if you've joined us in the last few minutes, we want to welcome you to this call with Congressman Ralph Norman. He has several medical experts on the line with him tonight who are discussing the coronavirus. We would love to make sure you know that you can press 0 if you have a question. We also want to encourage you to please press 7 on your keypad so you can get email updates from Congressman Norman's office. Please press 7. If you already received emails from Congressman Norman, you don't need to. But if you do press 7 now, you will be added to his email distribution list, and you'll be able to get the latest from his office. Congressman, our first caller is Karl. Karl, go ahead with your question, please. Karl, are you there?
Oh, yes. My question is, when will the spread of the virus focus stop and the focus be on the people who are most vulnerable, the old and the people with a compromised immune system, and allow the rest of the people go back, to doing business as normal?
Great question, Karl. Dr. Kacka, what's your opinion on this?
Sure. Unfortunately, we can't control the spread of the virus and who it spreads to without restrictions on everyone. Unfortunately, if we do kind of open it up to the population, eventually the virus does reach these more vulnerable populations. It's unfortunately not possible to put a shield around these vulnerable populations without getting more control over the spread of the virus. And that's why these more restrictive recommendations are being made for all populations, because we do need to control the spread of the virus. And ultimately, even younger people who are healthy, are having serious illnesses where they are getting hospitalized. So it is important that we do continue to limit the spread to everybody to make sure that we don't overwhelm our healthcare resources.
Yeah, and Karl, let me add one other thing too. That the number of cases are going to go up, and don't be alarmed by that, because more and more people are being tested. There's been a shortage of kits, which you can expect, but as it goes up, it's you're going to see that in the next days and weeks. But that's just the nature of the test being administered.
Thank you very much. Our next caller is Mike. Mike, go ahead with your question, please.
Yes, with all the positive news about the malaria medicine being used on this virus, if I were to show symptoms and get tested and came up positive, would my doctor be able to prescribe that medicine to me if I ask him, or is this something that's going to be prescribed anyway?
Dr. Poursina?
Yes. Yes, I understand that the malaria drug, the chloroquine or the hydroxychloroquine, as is available here, has been in the news. There has been some positive data based on the Chinese experience with this drug. However, this drug does have serious toxicities, so it's a case-by-case decisions. It's not yet proven to be 100% safe in every one of these cases, and one needs to weigh risks and benefits when you're prescribing such a drug. It's not a cure-all, and if a person is very, very sick with this virus, yes, prescribing this drug makes sense, because the risks associated with the drug definitely, are less than the risks associated with bad outcomes with the virus. However, if a person is not very sick with the virus, quite often they spontaneously recover and do not require any medications. So I would not recommend this medication for anybody who is tested positive with coronavirus. Most often we are going to be using it in extremely sick patients, those who are in the ICU and sometimes on the ventilator, those kind of cases, because it can have serious side effects.
Our next question comes from Deloris. Deloris, go ahead with your question, please.
Yes, thank you, Congressman. I was calling. I had a question about the stimulus package that you said that you all plan to pass. And I noticed that it said that all Americans would qualify for a check, but I'm hearing rumors that some people may not get it if they didn't file their 2018 taxes. And I was wondering, was that true? Because I know someone who's on Social Security, but they don't have to file taxes because they receive so little money. And I feel like that wouldn't be fair to that individual, especially if they're elderly and disabled.
Yeah, good question, Deloris. You know, nothing really has been set in stone on this. I will tell you the overall intent was to help the small businesses, which are where most of they're the backbone for the country and where most of the people have worked now. And it's meant to help those who have lost a job, been furloughed, and really for the lower income Americans. It's not intended for the CEOs who make a lot of money. On the take the paid sick leave, they've broken it down, which is 2 weeks. It's less than 500 employees, and the business must provide that. On the family medical leave, it's again less than five. If a business is less than 500 employees, you have to have certain requirements before that would kick in. On the tax credit, and this is one, I think, good part of the bill, 100% of the wages are paid for will be reimbursed through a tax credit, which I think is a good thing. I think a lot of the smaller testing for the virus, the test kits are going to be paid, and there won't be an additional cost on that. But to answer your question, it's a work in progress, but it was meant to help the everyday working American who makes up small businesses.
Our next question comes from Bruce, and Bruce asked to have his question read. His question is, the governor has closed all the restaurants and whatnot, but hasn't closed down bingo parlors. Why is that?
It's a good question. Dr. Kacka at DHEC, do you know the answer to this?
Can you repeat the businesses that were not closed?
Yeah, why? He's asking why government.
What were the specific businesses?
Why Governor McMaster has not yet closed down all the establishments in South Carolina, and he used as an example the bingo halls.
Some establishments we didn't have specific recommendations for. There definitely is a concern about any kind of mass gathering where people can come together. We have said in certain situations if they feel that they can practice the social distancing practices, that it potentially could stay open. But I can't speak to why particular businesses were selected to not be closed.
Bruce, let me add to that. I know that as you've seen on TV, probably a lot of the beaches in Florida, the spring break, teenagers and college students were on the beaches, and the governor in Florida is moving to shut that down. I got a call this afternoon for a particular racetrack that was going to be opened up and having people there. So I called the sheriff. I said, this isn't right. This virus is 3 times as contagious as the flu, and you ought to get involved. And he did. So in this case, anything like this in your community that you hear they're meeting, call your local reps, and they'll get involved, because this is very important.
Okay, up next we have Stephen. Go ahead with your question, please, Stephen.
Hi. I have a question that arose from a conversation I had with my aunt in another state. In her state, they had a person who decided that even though they had coronavirus, tested positive for it, she knew firsthand of this. This woman decided she didn't want to stay isolated, so she continued to go out and mingle with other people, and my aunt basically dropped a dime on her with the police. But I'm not sure that's possible here. I mean, how does one handle it if you know that somebody's doing something either selfishly or maliciously and they actually have it?
Dr. Kacka, give me your and Dr. Poursina, give me y'all's medical opinion. I mean, it's putting everybody at risk. Now, I think it's time to get involved. If somebody's doing that, that's so you're putting everybody at risk because of the contagious nature of this disease. So, no, I get in touch. I mean, if it were just me, I would not only tell the person, but I'd get in touch with the employer, and I don't know about the police, what they can do. Any of the doctors have an idea on that?
Well, I can, with coronavirus, of course, it's being such a new disease, I am sure that the police would have to follow the law, and I'm sure there are really no laws on the book on this. But in the past, there have been instances where people, this was during the HIV pandemic, when there were people actually who were intentionally, spreading HIV around, or would not tell the people they were with that they are HIV positive, and there have been multiple cases of persecutions and stuff like that in the past about this. Now, as far as the full extent of the legal ramifications of it, I can't speak to that, but I can certainly appeal to everybody in public to understand that this virus is highly, highly contagious, and even after a person may physically improve, they may continue to shed the virus. There are cases in people who are sick, sometimes they shed the virus for several weeks after. And it's very, very important, for a person who has the disease to self-quarantine themselves and avoid spreading the virus any further. Appealing to the public. I can't state this strongly enough how important it is for a person who's sick to stay away.
Yeah, I agree. This is Dr. Kacka again, and I will also add when we do have a lab confirmed case, we do contact them with official isolation guidance. And we haven't been issuing official orders as well. And the orders actually do have some force in them. We can particularly levy fines if we find out that people have violated isolation orders. One of the things we communicate as well when we provide this guidance is that in the event that they do violate the agreements and they go out and infect someone else, they could be subject to civil action, meaning that they could be sued by the person that they infect. And that's one of the pieces that we communicate to give it a little more force so that people understand that they do need to take this seriously and not go out and spread it to others.
Thank you. Our next question is from Carol. Carol, are you there?
Yes.
All right, go ahead with your question, please, Carol.
I wanted to ask, I have a child, well, he's 22, but he's been disabled since birth, and he's had several open heart surgeries, and he's got a very low immune system. And he's sort of paranoid at this time, but I guess it's better to be paranoid than just to let it go. But would you suggest just keeping him in, as he's been doing?
Dr. Poursina?
Yes, absolutely. One of the most important steps in prevention of this disease is social distancing, and we very strongly recommend that every person who has underlying conditions, and that includes anybody with cardiovascular disease, pulmonary disease, renal disease, severe uncontrolled diabetes, people with malignancies, chemotherapy, anybody whose immunity is not really intact, should stay away as much as possible from public locations and stay at home as much as possible. This recommendation is not only for the person who is suffering from these conditions, but also for the family members who take care of that person. A family member who goes out can easily bring the virus back with them to the household. And so I would highly recommend that, especially in case of your son, that social distancing be enforced as much as possible. In addition to that, again, hand hygiene, washing his hands and every household member's hands several times a day, and making sure that they stay away from anybody who's sick. Limit visitors as much as possible. So overall, yes, of course, he's at risk, but some of these common sense preventions work.
Thank you. Diane, go ahead with your question, please.
Hi, my question's for Dr. Poursina.
Yes.
Hi, I'm 67 years old. I have an underlying condition with a good-sized cavity in my lung, plus COPD. If I was to get sick, should I go to my primary care doctor, your office, or to the ER?
Yes. So one of the things that we have been recommending is that if you are sick, call your primary care doctor's office first. Having a phone conversation with the office, informing them about your condition is always the first step. That way, there are sometimes things that they can do over the phone, and there may not be a requirement for you to take it up another level or go to the emergency room and seek their advice. If your condition is severe enough and you're really short of breath, coming to the emergency room, you are obviously one of those high-risk patients that I was talking about. And if you are really short of breath and you feel like it's really bad, coming to the emergency room definitely is advisable. However, if it is something that it is not, you're not feeling sick enough, you just have a mild cold, but you're not short of breath, calling the doctor's office is usually the first step. If you're ever going to a doctor's office, calling them in advance, letting them know about your history as well as your current symptoms also prepares them in order to room you faster, making sure that you are not going to be spreading the virus to any other patients that are in the waiting area.
Okay, and our next question comes from Scott. Go ahead with your question, please, Scott.
Thank you, Ralph. I appreciate you doing this teleconferencing. I am a restaurant owner who I've had to close because the carry-out was just not enough to sustain, make it worthwhile. I mean, it's just costing more money to be open. But my question on that is, why is the restaurants, the table service, I understand the social distancing part, but when it came out with the directive, you couldn't have any sit-down eating inside or outside, which at first we had put like 3 tables outside, 10, 15 feet apart, so we read you couldn't do the outside part. So, we don't want to infect anybody. We don't want anybody to get sick. We want to do our part. But what I don't understand, it's critical for restaurants to stop serving people like that. And everything else can stay open. You can go sit in a waiting room at a tire store. You can go to a convenience store, go inside, fix a hot dog, or order a pizza or a sub sandwich, pump gas, and all this. And they're not doing anywhere near the sterilizing that restaurants do. So I feel like we kind of got unfairly targeted. And then my second question is, for the 18 people I've had to lay off, is there any plans to increase the unemployment compensation for these folks? Because they only get like a third of their pay. Like our waitress staff, they get like $100 a week.
Sure. Well, thank you, Scott. First of all, from my understanding, it went to the restaurants pretty quick because, one, you're involving your hands, both eating food and being served the food, and it's just more of a way that the virus would spread. Secondly, it's kind of morphed it's morphed in such a greater extent with people getting the virus that it's now into the airline industries are slowing down. Everybody that's having to close, and what they've done is to try to limit this thing as best they could, which was just pretty much putting everybody out of business for a short time, and then hoping to either stem it or stop it. You've got warm weather coming, which is it will help us out. So that's why it started with the restaurants. And I mean, I'm in the real estate business, and it's been a severe hardship for everybody. The waitresses I feel particularly sorry for because they survive on tips and a low income anyway. Now, as far as the unemployment, the increases, I haven't heard of anything on that. If that's going to be increased, because the wages they're making now are not even sustainable as they are. So I haven't heard of that, though, not to say that it couldn't. Now, any of the doctors want to weigh in on this?
This is Dr. Kacka. So, yeah, it's unfortunate that some of the restaurants have been affected in that way. It seemed like a good alternative to have them switch to go service. And I understand that some restaurants, it just hasn't been sustainable for them. And we're very sorry to hear about that.
All right, let's take our next caller. This is Bob. Bob, you're on live. Go ahead with your question, please.
Yeah. Hey, Ralph. It's Bob Decker. I'm out of the country in Mexico, working in Lazo Cardenas. We're loading a vessel, and unfortunately that vessel is not going to be done until next Friday, and we've got a lot of money invested in this. I can't leave it. So I just wanted to make sure I talked to the U.S. Embassy earlier today, and they're saying, I still can get back into the country if I'm going home, no matter what. But I want to just reconfirm that with you.
Yeah, let me let Kathy Rose. Kathy Rose, are you here? All right, let me let Kathy Rose. We can help you. We need to be in on this anyway to make sure that what they're telling you is right. But hold on, let me let her address this, Bob.
Sure, thank you.
Sir, it's up to the local government, and as long as those borders are not closed, there are other countries where the government, the Prime Minister, or the President has closed the borders. So I would highly encourage you to be very alert, as you already are, of those border closings and whether or not the country will allow you to leave. Otherwise, we are working around the world with Americans we have in countries around the world to bring them safely home. Does that answer your question?
Yeah, I'm staying in touch with the embassy, and I guess, Ralph, maybe I stay in touch with your office too.
That would be wonderful. Yes.
Yeah.
And let me give you the number here.
Okay. Hold on a minute. Write it down.
And anyone else who has any questions, they're more than welcome to call the office. We're going to be monitoring phone calls even over the weekend.
Wonderful. Okay. Go ahead.
It is 803-327-1114. And you brought up a wonderful point in that it is always a good idea when one travels abroad and a situation comes up, or you think a situation might come up, that you go ahead and make sure that the United States Embassy knows you are in that country. So you did the right thing. I applaud that.
Okay, thank you very much. We will take our next caller.
Okay.
Coming up next, we have Lorenzo. Lorenzo, please go ahead with your question.
Yes, my question is in reference to the testing. I understand that the main focus is people that's having symptoms. If they're having flu-like symptoms, they can get tested. And I also understand that this virus can affect some people and they don't have any symptoms. So these people that don't have symptoms, what's going to stop them from infecting other people, and how would they initially get treated?
I'll refer that to either one of the doctors.
I'll give my 2 cents, and then probably Dr. Kacka can elaborate more on this. My take on this question is that it's in 2 parts. One, yes, there is an asymptomatic shedding phase, and there are people who do shed the virus and do not have any symptoms. And yes, they can be infectious to others. That is definitely true. But on the other hand, there is also a limitation of the number of tests that are available. And because in this season we do have a lot of other respiratory illnesses, and there's a lot of flu, there's a lot of other viruses that are making people sick as well. And quite often, some of those viruses do have treatment, and quite often we use the test to distinguish or help us decide whether the person who is symptomatic, does he have the flu, does he have the coronavirus or one of the other viruses, and it helps us in clinical decision making and treatment. However, due to the shortages in the number of people that can be tested, in the number of kits and the difficulties that we have had, right now I believe we should limit it as much as possible to people who are symptomatic, because it helps us clinically in helping them. However, if at some point the test can become so abundant and so universally available, I'm not averse to getting everybody tested, and anybody who is shedding the virus in spite of having no symptoms should be quarantined.
Yeah, this is Dr. Kacka, and I agree with everything Dr. Poursina said. I'll add on to that as well. We get the question a lot of why we are not testing individuals. We could have been exposed to the virus but aren't having symptoms yet. So there's a very important point here that there's this period, it's called the incubation period, between the time that the person is exposed to the virus and the time that they first start showing symptoms. Now, it's what this test does is the swab of the nose, and it actually detects the virus inside the nose. And we know that if they're infected with the virus, we can detect it at the time that they're showing symptoms. It's possible that there's some point before they show symptoms that we would be able to detect the virus there, but it doesn't happen immediately. There's going to be a long period of time where we couldn't detect the virus. So if we test them and then they come back negative, it doesn't mean that they don't have the virus on board. It just means we couldn't detect it in their nose. So these people could eventually become sick anyway, even though they tested negative. That's why we don't recommend any testing be done until they become symptomatic. Because of the issue, like Dr. Poursina said, that we do have limited tests at this point, and we do have to prioritize how we use them.
All right. Thank you very much. Up next is Mark. Mark, please go ahead with your question.
Hi, this is Mark Kahn. How are you, Ralph? And I want to commend you on these talks that we have. It's very informative, and we really appreciate it. But I got a couple of questions for you. One is, how about relief for homeowners? If they're unemployed, and you know unemployment doesn't cover a lot of expenses, is the government can do something with the lending institutions by maybe deferring their payment to the end of the loan so they don't foreclose on the property? Do you want me to go each question at one time? Or
yeah, let me answer that one first, Mark. And I'd do two things. One, you need to notify your lender that you're out of work. I would get a slip from or some type of paperwork from your employer saying that you're now no longer working. I would definitely certify it so that you're on record, so it can't get lost with somebody saying they didn't get it. Secondly, yes, I think not only is the president and Secretary Carson, who heads the housing agency up, he's halted all evictions and foreclosures. And I've seen most of the banks now are willing to work with you. I mean, this is unprecedented. And the last thing that they want to do is foreclose on something that's expensive, takes a long time. And, just from the human aspect, they understand this. So, but get on record with it. And, yes, the banks will help out on this. You have a medical question, Mark?
Yeah, there's the one about the surfaces. What surfaces take, like one of the doctors said, that the surfaces, it takes longer if it's in a box or if it's in a letter form. Some say use gloves when you're picking up a box from the mailman and let it be into the garage for a day. But he says different surfaces. What should we look out for the surfaces so we can be more careful?
Either doctor.
Yeah, so Dr. Poursina here. So the surfaces, this came out of some of the studies that they have done looking at the virus survival rate on different surfaces, and the material that the surface is made of makes a huge difference on how long the virus survives. The virus usually in an aerosolized form survives for about an hour. However, depending on the size of the contaminating, contaminated surface and what the contamination was like, if it's a drop, if it's a droplet, if it is some sort of a body fluid, and the type of the material the surface is made of. We have seen that some surfaces, for example, stainless steel, the virus can survive on it for a long time, so up to like 72 hours, 3 days. But there are certain other surfaces like copper, the virus tends to die on pretty quick, about 4 hours. So different surfaces like plastic, again, it tends to survive a long time. Cardboard, something around a day or a little longer. So yes, it does survive for quite a period of time. In general, the harder the surface, particularly stainless steel, it survives for a long time.
Sure, and this is Dr. Kacka. I will just add on to that. I agree with everything Dr. Poursina said, and that kind of hits on why it's so hard to answer that question, how long does the virus survive on surfaces, because there's so much variability depending on the surface and a lot of different factors about the environment, and that's why we try to focus on the recommendations that we know work, which is, everybody's tired of hearing it, but wash your hands, trying not to touch your face, and making sure to clean those highly touched surfaces like doorknobs and counters, cleaning those frequently. It looks now like pretty much any registered EPA disinfectant is pretty effective at clearing this virus from any surfaces. So those are kind of my recommendations when people ask about the virus on surfaces.
And let me say, your phone is a big carrier. You need to wipe your phone down, which everybody uses every day, but that needs to be wiped down.
All right, up next we have John. John, go ahead with your question.
Hey, Congressman. My wife and I own a few restaurants in York County, South Carolina, and we've had to close, unfortunately. And I heard you talking about the stimulus package in Phase 3. I mean, I hear the hotels are being helped and the airlines and some of these fast food places, but what's going on with the restaurants? I know that there's some small business loans with small interest rates out there, but we're losing a ton of money having to close our doors being a upscale restaurant, sit down. What's in the package that's going to help us?
Well, time will tell. $300 billion of it was earmarked, and there's some more coming down the pipe as we go back to Congress, go back to Washington next week. Will it? The main thing is to eradicate this virus and go back to work. That's the only thing that's really going to solve the problem you're having, and everybody really, from small business to big business. So it's just, is it going to cure it? I don't know, but not doing anything, we couldn't do that. We had to make a stab at it, and this is just a stopgap measure, John, because as you know, unemployment insurance is not you can't live on it, and so time will tell with it. I hope it will, but the stimulus is just the first step to try to get it.
Thank you very much. Thank you very much. Up next is Marcus. Go ahead with your question, please, Marcus.
Yes, sir. I was curious about with the different parts of the country doing quarantines and limiting the supply chain as how that's going to affect your grocery stores. And then I do have one more question to follow up with that, sir.
Well, I'll ask either of the doctors. I guess your question is, if you stand beside people in grocery stores, what risk are you? Either of the doctors want to weigh in on that?
Sure, Dr. Kacka, DHEC. Our expectation is if you are going out in public, you're practicing those social distancing practices and making sure that you're kind of keeping your distance between people. You're not going into any environments where it's too crowded and you potentially could be exposed. And something to keep in mind with that, people may misunderstand. You really, to catch this disease through the air, you really need to be in close contact with someone for a good amount of time. So keeping your distance is a good idea. You don't have to be overly concerned if someone does kind of break that 6-foot barrier around you for a brief period of time. Those kind of brief exposures don't really matter. But making sure if you're going into an environment, it's one where you can practice that good social distancing practice.
All right, and then Marcus has one more question. Go ahead, Marcus, please.
And I was also curious about if, with like getting ahead of the disinfecting and everything, why are we not using things like the mosquito trucks through the heavily transported area with some form of disinfectant, similar to how the Chinese did when they were going through and disinfecting their cities?
Yeah, good question. I don't know. You may see that. Again, we're just kind of reacting now the best way we can, and whether the trucks will start spraying like they did in the years ago, I guess we'll have to wait and see. But they're not doing it now, to my knowledge, because really that was done during the dead of summer, and of course we've been through the winter and getting over that. So if it could happen with the summertime.
Our next caller is Millie. Millie, go ahead with your question, please.
Yes, sir. I was just wondering about senior citizens is not able to get out, and there's nothing on the shelves nowheres, and how do we get what we need?
Well, Millie, and I'll refer this to Dr. Kacka since he's with DHEC, but your churches will be a great access for food. A lot of them are volunteering that. I would touch base with them. And Dr. Kacka, DHEC, is anything set up that you know of?
I'm not aware of any specific programs that have been set up. This is why we are encouraging people to kind of reach out to their neighbors and find out who does need help, so that these kind of programs can be set up in these populations that have a more difficult time getting out, can get what they need so that they aren't out where they put themselves at risk.
Do this, Millie. Call or send us your contact. I know there's $250 million set aside for senior nutrition programs. There's I think $160 million for home delivered meals for senior citizens. They're agencies that you could contact. The Area on Aging is a local agency that you could contact. But call us if you have trouble with doing that. And we'll be glad to help you out on that.
Thank you. Mary is next. Go ahead, Mary, please. I'll read Mary's question. She said, if you have a college-age student who is returning home and there is an immune-compromised individual already in your home, how am I supposed to handle that? Do you just assume that the person coming home has come in contact with another person that has the virus?
Either doctor want to tackle that one?
Well, this is Poursina speaking. So, as a rule, if that college student returning home does have any symptoms of any cold or respiratory tract infection, definitely making sure that the immunocompromised person is kept away, and preferably in a separate. The person who's sick needs to be in a separate room, as much as possible. Distancing themselves from the rest of the family is the key. Observing hand hygiene and good common sense practices is definitely called for. However, if the college student is not symptomatic and they continue to remain asymptomatic after coming back, I don't think one needs to worry too much, and about the immunocompromised individual at home. Obviously, during travel, a person may have exposure to these kind of stuff, and it's an evolving science as far as the incubation period of this virus is concerned. But as a rule, young, healthy individuals tend to do very well, and the chances of them getting sick or making everybody else sick is quite low.
Thank you. Folks, I want to remind you to please press 7 on your keypad if you'd like to have your email address submitted to the Congressman's office to get updates. Please press 7. Our next caller is Becky. Becky, go ahead with your question.
Hi. I have a question regarding labor and delivery. I've heard a lot on the news about, steps we're taking for regular emergency work if, somebody's in an accident, et cetera. But I've heard nothing positive about isolating labor and delivery rooms. I have a daughter who's a high-risk pregnancy that is due in the next couple weeks, and she's very concerned about what we're hearing about nurses being taken from the labor and delivery to go work with COVID patients, et cetera. So we're wondering, has there any thought been put out about isolation and control for, that type of emergency, someone going in labor and needing to get in the hospital right away, a family member, so you need to bring them, et cetera. And actually, I thought of a second question that I didn't mention before, if I have an opportunity to ask that. Thank you.
Dr. Poursina?
Yes. So there are some circumstances due to nursing shortages, or if some of the nurses that have been exposed, obviously they are asked to self-quarantine for a couple of weeks, and sometimes they don't even they are not in the hospital anymore. But as a rule, any nurse that is taking care of a person with known coronavirus or a patient that is under investigation for coronavirus, we try our best to make it a one-on-one situation, and that nurse usually is not allowed to go back to take care of labor and delivery anymore. And that is a good common sense infection prevention practices. As far as labor and delivery places in the hospital are concerned, they are usually at a more remote part of the hospital, and there is rarely ever any access from the rest of the hospital to that area, and there is a lot of foot travel or a lot of exchange of staff or people coming and going from the main hospital through the labor and delivery wards. And I've not really heard of any incidences where something like this may have occurred. Additionally, if you look at most of the statistics from other countries and who have experienced this, most pregnant women, at least those who got the coronavirus, did quite well, and even their babies did well afterwards. And the chances of there was really no recorded cases of mother-to-child transmission of the coronavirus in any of those cases. But yes, it's a valid infection prevention concern. But so far, the hospitals that I am aware of have done an excellent job mitigating that risk.
Okay, our next caller is Tom. Tom, go ahead with your question, please.
Hello, Ralph. This is Tom Pierce. I had a rather lengthy question, but we'll try and compress it here. The millennial group has been discussed and is documented video of them on the spring break, and you observe them in the neighborhoods where they're all getting together. The kids are playing together when they're out of school, and they're not paying attention to the message. And we know that what's being explained in President Trump's news conference is 20 to 45-year-olds are susceptible, and I believe there's a 44% rate of those people that are seriously affected. So how do we get the message to them to help participate and go along with the rest of the people that are trying to flatten the curve?
Well, really it boils down to parents. They're the ones that are affected. Yes, the college students and the teenagers can get it. They just don't see the severity of it. They're going to feel it because they're going to see it with the parents and their providers, because you can't go in a city in the United States that's not basically shut down. So what I would say is the parents and everybody needs to weigh in on this. Being quiet is not something that any of us can afford to do. And I've mentioned it to several groups, and I think all of us should. But it basically boils down to the parents to keep an eye on them. And I'm not saying it's easy. And most teenagers think they're invincible and never will get sick and it won't hit them, but that's not the case.
Okay, next we have Simon. Go ahead with your question, please, Simon.
Yeah, I've seen these studies done on virus payload and your blood type, other markers like that.
Either doctor?
Dr. Kacka, DHEC. I've heard rumors of that, but I have not seen any published studies on effects of blood type on outcomes from the virus.
I think we've lost Dr. Poursina for a moment.
Okay.
So he won't be able to answer this question.
Okay.
All right.
Thanks.
And our next call is from Kelly. Kelly, go ahead with your question.
Hey, good afternoon. Thanks to you all for being here. I had two questions, actually. One, you mentioned the incubation period. Do we have a idea what that is from time of exposure to time symptoms are apparent?
Yes,
Dr. Kacka.
We have some pretty good data now that it's typically around 5 to 9 days. It can be as short as 2 days and up to 14 days.
Did that answer your question, Kelly?
I think we've lost Kelly. We can go on with our next caller.
Okay.
This is David. Go ahead with your call. Question, please, David.
Yes, I'd like to know about the stimulus package, and how much is they talking about giving, like, families who file taxes, and if they could give the thing to the kids for, like, family that have kids with this stimulus package, and for the people who hadn't filed their taxes, are they eligible to get the money with the stimulus package?
All right, David, let me break. This is how it is right now. It's based on the income and family size. Each individual would get up to $1,200, $2,400 for married couples who file jointly. Each child would get $500, and from there, that's pretty much the only thing that I'm aware of that's in stone or that's projected to be in stone as we move forward.
Thank you. Our next question comes from Tom. Tom, please go ahead with your question.
Hello, can you hear me?
Yes, sir, I can hear you, Tom. How are you?
I'm good. Listen, I'll be 88 years old in July. I've been self-quarantined for the last 8 days. Figure I got another 5 or 6 days to go, but my question has to do with what I understand is that it's been discussed that a lot of and I get most of my medications from the VA, which is a good thing, and I appreciate that. But I understand that most of our pharmaceuticals are imported from China. Is there anybody up there, anybody that has been in Washington D.C. that can explain to me how something like this could happen, and knowing this, what is being done about it, so we know that our medications come from a place we can depend on. China could cut us off any time, I reckon. Go ahead.
Well, Tom, it's if there's any one good thing that's going to come out of this, it's going to show America that sweatshop labor from a communist country is not cheap after all. And you're right. A lot of the ingredients that come for our pharmaceutical, for the medicines, come from China. We've got to get away from that. We can't rely on particularly a communist country that sweatshop labor, and we've got to get other means to manufacture it in America. And I think that's one of the good things that'll come out of all of this, along with so many other good things. We've got to close our borders. We got to know who comes in here. And we've got to look at every country that provides products for us just because it's cheaper. After this, I think we're going to be willing as Americans to pay more to have the security with it. And we're taking it seriously now. And it's one of the good things that's coming from this.
Okay, up next is Todd. Go ahead with your question, please, Todd.
Congressman, this is Todd Montgomery, and I thank you so much for your service and what you do for us. I'm running into a lot of people, they're not concerned and they're not taking this thing seriously. And to be honest with you, they got a lot of mistrust and they don't believe this is real. What can you do to help us?
Well, if they don't think it's real, tell them to go in any grocery store and see the shelves not stocked. Go to any restaurant that used to be open. Try to get an airline ticket now. It's serious, and just as you've heard the doctors say, this is not a virus that you can play with. I mean, it's 3 times as contagious as the flu, and we've got to take it seriously. And really, that's where I call on the public. That's why I'm doing what I'm doing right now, having a Tele-Town hall to have as many people have a wake-up call that this is very serious, and we're going to come through it. But we cannot allow people just to go think it's business as usual. And a lot has been said about the younger generation not taking it seriously. Well, it's up to us to voice our opinion with it, because particularly it's not fair for our elderly in our nursing homes to suffer from a disease when their life can be prolonged. And it's just up to Americans to do that. Yeah, I can't pass a law that's going to make people not go on the beaches, and I can't pass a law to say take this seriously. But I can tell you one thing: I can use my voice to let people know, which is again why I'm doing this.
Thank you, Congressman. Up next is Jessica. Go ahead with your question.
Hi there. My question is, what criteria are being used to determine who needs testing? So I know that we have a limited number of tests, and I'm just curious how symptomatic someone has to be. So I'm concerned because recently I've still heard reports of people being required to have a travel history or contact with a known confirmed case before they're approved for testing, or to be required to be severely ill. And so my question is, if that is still the criteria, and if it is, then do we have any backup for surveillance in our area? So do we have any routine surveillance to determine if there's an increased incidence in influenza-like illness that are not flu-related or other known viruses? Basically, do we have like a backup warning system that will tell us when we have more prevalent community spread before our hospitals and ERs are overwhelmed?
Either one of the doctors?
Yeah, Dr. Kacka at DHEC. So I'll address the testing criteria first. So the criteria you were talking about was the more restrictive criteria. It's now since been opened up that physicians and other healthcare providers can make the call themselves if they want to test their patient. We have a process that they can submit either to DHEC's public health lab, or there's many commercial labs that offer testing now as well. We do give some guidance on who should be tested based on the fact that, there is going to be a limitation in testing, and we do want to make sure that we do have testing available when it's absolutely needed. So we don't necessarily look at the severity of the disease anymore. That's of course not a very good way to do surveillance. So we do say if they have had known contact with a case, or if they've traveled to an area that has a significant spread, obviously, and they have to have the symptoms as well, those people still should be tested. Beyond that, for anybody who has the symptoms of COVID-19, the fever, respiratory symptoms, cough, difficulty breathing, we prefer that if the provider can, if they do alternative testing looking for flu, other respiratory viruses, because it's still more likely going to be that. In fact, only 10% of the samples that we've tested at our public health lab have actually come back positive for coronavirus. So it's still a lot more common viruses that are causing the illness out there. But if it ultimately does come down to the provider to decide if they do want to do the testing.
Okay, and our next question is from Georgia. Georgia, go ahead with your question.
Thank you, Congressman Norman. My name's Georgia Linkus Long. Mine's kind of a three-part, and I apologize for it'll take a little bit. I am a durable medical equipment consultant, and I'd like to be able to volunteer that I can track down anything that any of the healthcare officials need to protect themselves, and I have no problem volunteering that. Plus, anyone with ostomy issues, if they're having problems finding supplies, I can track that down as well. And I also have about 10,000 available for donation. And then my other part is I am a Rice syndrome survivor of 1974, and I was also in a coma. Is there any way that we can utilize my information of surviving for any of the healthcare officials, because I had chicken pox, the flu, bronchitis, and, of course, baby aspirin. And I would love for that topic to be talked about. And then the third part is I'm also a jeweler, and the one thing that I notice when I go into any hospital is a lot of times the healthcare providers have a lot of jewelry on, but I notice that their jewelry has not been cleaned in a long, long time. A lot of people forget that bacteria builds up in there. But that's my three-part, and if I can have that addressed, I'd appreciate it.
Well, Dr. Kacka, what would you recommend on if she wants to donate masks and things like that? Would DHEC take that?
Sure. There's multiple ways to contact DHEC if you do have items that are available. You can. There's a Caroline. I can give you that number for the Caroline. That's probably one of the easy ways to get through. It's 1-855-4 SC DHEC. I don't have those numbers in front of me, so it's 1-855-4 7 2 3 4 3 2. Sorry, I had to look at my phone to figure out what numbers those were. So that's a way to contact DHEC if you do have something available.
Yeah, and and thank you for doing that, as well as the sterilizing the jewelry. Call our office if you've got a pen. My office is 803-327-1114. Call that if you didn't get what Dr. Kacka had. We'll be glad to take you up on that.
All right, Congressman. Our next caller is Sherri. Sherri, go ahead with your question, please.
Hi, Ralph. It's Sherri East. My question is about the life of the virus in air. Like how viable is it in air, and the distance? I know we were practicing social distancing, but how long can it live in air? And is there any danger to people that want to work in their yard or walk in a park or just be outside in general if they're not around other people?
Great question, Sherri. Either Dr. Poursina, if he's back, or Dr. Kacka.
Yes. So the virus, we know that it aerosolizes. So when a person coughs or a person sneezes, Many times these droplets can travel a very long distance, sometimes even up to 6 feet. And we know that the aerosolized particles can stay viable for up to 1 hour. However, in open spaces, this is pretty much quite well mitigated. It gets dispersed and it falls to the ground pretty quick and it doesn't hang in the air in an open space for a very long time. The problem that we face is mostly in enclosed spaces and very close proximity to people when they're coughing and sneezing. In open air, I do not believe you will have this kind of a problem.
Thank you. Our next caller is Vivian. Vivian, go ahead with your question, please.
Appointment. How do we take that interview?
Hi, Vivian. Are you there with your question?
Yes.
Go
what
ahead,
about
please.
ordinary doctor's appointment? How do we go into that too?
Great question. Either doctor want to. I guess your question: should you go to a dental or a doctor appointment now? Either one of the doctors want to answer that.
Yeah, Poursina here. So the current recommendations are we are trying to limit most elective procedures as much as possible. So if it is not something that is urgent or emergent, avoiding any kind of public places or doctor's appointments is probably a good idea. However, that it's a kind of a case-by-case, decision, and depending on what kind of a doctor you need to see. We are encouraging a lot of doctors to do phone interviews and questionnaires and screening of the patients, and many of the practices I'm aware of have started doing even telemedicine and use of internet or phone to communicate with the patients.